Welcome to Staying Safe While Working in the Community Mini Module 6 Environmental Risk Assessments. In the previous module, we covered client risk assessments in Module 5. Now we're moving on to environmental risk assessments. This is part 6 of an 11-part mini modules. And once you complete all 11 modules, then you will get the certificate for completing all of this training. So when we look at things to consider when working alone in the community environmental side risk factors, we need to look at lighting, inadequate lighting, both interior, exterior in the community, dangerous stairs, walkways, driveways, evidence of tobacco use and other substances, non-compliance with pet policies, inappropriate storage of weapons, oxygen use, inadequate storage and disposal of hazardous material, fire, safety concerns, the hazardous internal home environment. So this will cover many things like floor, clutter, litter, hoarding, layout, no or non-functioning phone, and then service requirements around manual lifting and handling of materials like laundry and other equipment and furniture. So the first thing we're going to talk about is lighting, and this is both inside the house and in the exterior of the building, and especially if you're there overnight or doing a respite late in the evening, and especially in the winter, it gets dark very early. Lighting is very important, so we need to make sure, and sometimes we don't realize if our previous visits have been in the daylight hours, we don't realize that there might not be proper lighting. Additionally, there's also things we need to consider on the exit, both going into the house and stairwells when you get in the house. So it may be, very steep inclines and declines. The surfaces may be poor and poor repair, and that happens many times in walkways and driveways. Steps can be loose or railings. Poor maintenance of the surface, and that could be just repair, or it could be as a result of weather conditions. So all of these things, of course, need to be documented and reported to the supervisor, and the client's family advised of those things so they can fix those problems to meet the standards that we have set out. So evidence of tobacco or other substance, so evidence such as odor or residue, if there's maybe suggestions of a violation of the drug and alcohol policy. So that may be, as you may smell strong tobacco, or the room may be filled with smoke, or the individual may be intoxicated or impaired, and this needs to be documented and reported to the supervisor to ensure that they're compliant with the policies that are set out. So we talked previously in the earlier module about the pet policy, and I know some organizations don't have a pet policy, but for those that do, pets are need to be away from the home care or the home support worker. All pets must be secured in a separate room away from where the service is being delivered. And I know it's difficult because many of us are pet lovers and we have pets of our own, and we don't see them as being an issue. And I've had nurses tell me that they find it very distracting when they'll be in the bedroom and the dog's scratching on the door to get in, and they're trying to concentrate on whatever procedure or services they're trying to provide. So even though it's distracting, repeatedly we have animal bites, both cats and dogs, that are service and home care providers receive as a result of not following the policy. And usually once they've received a bite or some kind of altercation with the pet, that usually they're more likely to be compliant with the policy. My recommendation is you follow the policy from the beginning and save yourself from the dog or animal bite. So inappropriate storage of weapons. So weapons that are not secured or out in plain sight. So an example includes firearms that are not secured in a locked gun cabinet away from ammunition, large hunting knives in plain view. All of these things need to be reported, and you need to make sure you're safe and get yourself out of that situation need be. And this is very prevalent in rural communities where there's avid hunters, and people don't sometimes even realize they're there because they've always been up on the mantle or wherever they may be, they've always been there. So sometimes we have to make that clear on what the requirements are. So if your client is using oxygen in the home, you have to make sure that there's adequate signing, and you need to make sure that they're following all the safety guidelines. So some things that you need to be concerned about is if the client continues to smoke or allows visitors to smoke when oxygen is being used in the house. There's rules and regulations around signage, so signage not being present about the warning, and it needs to talk about smoking being strictly prohibited. So again, if there's violations that aren't following the guidelines with oxygen being used in the home, then that needs to be documented both to the supervisor, and in turn the supervisor needs to discuss that with the family. So sometimes there can be other toxic chemicals that are present in the home, and we need to make sure the staff are aware, and sometimes you can have two cleaning chemicals, but one can be bleach-based and one can be ammonia-based, and mixing those together accidentally could result in some vapors that could be very harmful both to the worker and the client. So all chemicals must be, the worker must understand what chemicals it is they're dealing with and make sure that they're stored properly. And it's always a great idea when less toxic chemicals are being used, and if something is extremely toxic, then maybe that's something you can talk to the family member about, or the home care provider may opt not to use it. Fire concerns, especially when it comes to electrical, wood stove, and other heating sources, especially when we get into the winter months, are always a huge concern. So I think that, equipment or behavior that predisposes home care and home support workers to an increased risk of hazard from fire needs to be addressed. And some of those examples are malfunctioning stoves and ranges. Wood stoves are very popular in Nova Scotia in the rural communities. And if they're not been properly certified or they haven't been maintained, that can lead to some concerns. There's also other types of heaters that are very used a lot in space heaters, kerosene heaters. All of those, if not handled and stored and treated properly, can result in fire hazards. And then there's other things with frayed electrical cords or cords running under mats and carpets, and sometimes in older homes there wasn't the same number of electrical outlets, so outlets get overloaded. And then if there's also combustible fluids in the same area where there's open flames or flames happening, then that's something that workers need to be aware of. And And that's what the important part is, if you're doing that continuous hazard assessment as you're going through the home. And as the seasons change, you may have started working with that client in the summer and didn't really notice that there was a whole lot of issues, but now they have the wood stove going, they have electric heaters going, they have a kerosene heater. So all of those things in combination and not being stored and used properly could raise concerns about fire hazards. One of the next areas is about the internal home and its environment, and one of the things that, you know, it could be things around the floors in poor repair, throw and scatter rugs through the home. I know we try to ask clients and families to remove those. Frayed cords, appliances that need repair, exit and hallway doors blocked with furniture or other clutter, and then pest infestations, so whether it's fleas and mice and other things. And what I'm hearing from a lot of folks is there's a real rise in the clutter, and I guess more in hoarding than anything else. So if that is what's going on in the house, you have to make sure in the area where care is being provided and our workers are working that those things are addressed and that there are the appropriate exits available to them. So when they're there providing their work, they're confident that if they need to exit the building, they can. So today, a lot of our clients still have phones in their homes, but more and more people are moving away from a house phone and only having a cell phone. So you need to know before going into the home, is there a functioning phone? Is there cell phone coverage in the area you're working? And then do you have pre-recorded any emergency numbers or contact numbers that you may need? So if you're in a dangerous situation or a very hazardous situation, you need to be sure that you can get yourself out of that situation, get yourself to a safe location, and or, you know, call 911 whenever you're safely away from the situation and able to do that. There's also lots of other things when we're doing home care. We're doing a lot of material handling as we carry out tasks, as we're lifting and lowering and pushing and pulling the vacuum and taking laundry down to do that and other tasks. So you need to take those into consideration. Make sure that you're handling using the most appropriate body mechanics to reduce any sprains or strains. And, you know, sometimes it may mean that you have to make a couple of trips down to the laundry if the laundry basket is really overloaded. And so take all of those things into consideration on how much you're lifting and carrying when, and make those changes. That is the end of mini module 6 on environmental risk assessments. You now can complete the form and answer the questions, and upon doing so, you can then move on to mini module 4. Thank you.